Hello, class. My name is Myrran Riley, and the sexually transmitted infection that I was assigned is called Chancroid. Chancroid is a sexually transmitted infection that is caused by the ulceration of the lymph nodes in the groin. One of the causes of Chancroid is by a bacterial infection that causes open sores on or around the genitals of men and women. It is a type of venereal disease that is transmitted through sexual contact, but this infection is not quite often seen in the United States. The more popular countries would be Africa and Southwest Asia, where the disease is mostly seen. People who typically live in the United States have traveled outside the country where the infection is more popular to be diagnosed with that. Another cause of chancroid is by a bacteria called Haemophilus ducreyi. The symptoms of chancroid do vary between men and women. They do begin 1 day to 2 weeks after exposure. After a person contracts chancroid, they will receive a bump about 1 day after exposure, which will then become an ulcer. Typically in men, they usually receive 1 bump, but in women, they receive about 4 bumps. And in men, the most common places that the ulcer would be found is foreskin, the shaft of the penis, and the head of the penis, and the scrotum. And in women, the ulcer is most common in the lips of the vagina. Some additional symptoms for men and women that have contracted chancroid are that the ulcers may bleed easily if touched, that pain may occur during sexual intercourse or while urinating, swelling in the groin, also the lower abdomen and thigh. Swollen lymph nodes can break through the skin and lead to large abscesses that drain. That occurs about 50% of the time with lymph node swelling. A healthcare provider can diagnose chancroid by looking at the ulcers and also by checking for swollen lymph nodes. There is no blood work necessary to determine if a person is diagnosed with chancroid or not. The healthcare provider will take samples of the fluid that drains from the sore, and the samples will be sent to the laboratory for analysis, which would completely confirm if the person is diagnosed with chancroid. The infection chancroid is usually treated with antibiotics. Large lymph node swelling needs to be drained either with a needle or a local surgery. Chancroid can also get better on its own, but some people do go through months of painful ulcers and draining. And so the antibiotic treatment clears up the lesions quickly with very little scarring. Although chancroid is not very common in the United States, it is still a sexually transmitted infection that should try to be prevented. And the only way that sexually transmitted infections can be prevented sometimes is safe sex. So I do say to all to please practice safe sex if you are having sex, because sexually transmitted infections and diseases are something that a person does not need to mess with. Thank you all.